James McLemore, serving as your first deputy chief. Just like to say thank you to Chief Hill for having our safety brief today. We have a lot going on in the organization. First and foremost, I'd like to credit our testing team. We were able to get the testing done this past weekend, and I'd like to congratulate all those that have tested and moving on. And also, on the forefront, we know that our COVID numbers are up. Continue to be safe, be careful. And just like I've said before, we have a lot on the horizon, monkeypox, different variations of COVID. So continue to be safe. That new variant is easy to catch. So continue to be safe and be careful. I know it's been running on the internet. I think we're going to cover it a little later. New York had an entrapment stabilization taking place, and they kind of got away from them. And so I just want the members to stay safe, make sure you're aware of everything, stay situationally aware of what's going on around you. Very important, very vital. But I'm not going to be long with it. I'm about to turn it back over to Chief Hill. Thanks and have a great day.
All right. Thank you, Chief McLemore. We appreciate you coming in and getting us started. We're going to move forward here. We're a little rusty because we haven't had these every week. We were having them every week. Everything kind of went off without a hitch a little bit better, but it's okay. We'll work our way through it. All right. So there you see what we're going to talk about today. We got the COVID brief, procedures update, monkeypox update, and then safety concerns. We have Dr. Bowers on with us today, who's going to go over and share some things from what she's seeing in the emergency room field and out in the exactly what you're seeing in the field, but she's seeing it from the hospital side, and she will comment on what we're going through here today. So with that, we're going to go ahead and start with the COVID brief. We have David Mayfield's going to show the numbers for our last 7-day average.
Hey, good morning, everyone. It has been a few months since we've had these weekly COVID briefs, and like Chief Hill said, we got to knock some rust off and get a little smoother, but we'll get better at it. So the country is averaging about 126,000 new cases a day, a rate that is about 28% more than a month ago, and a modest 2% increase over the past 7 days. But over 97% of the country is within communities where transmission levels are either high or very substantial. The nation's highest case rates are quite scattered, with Hawaii, Florida, Alaska representing the highest per capita rates in the country. The COVID-19 hospitalizations are still climbing, a near 8% rise week to week. The southern states and states in the Southwest, West Coast, are experiencing the highest number of new admissions. Death rate continues to remain relatively steady since mid-May, and we're averaging between 300 to 350 new deaths per day. And driven by the highly transmissible BA.5, the country's positivity rate has been rapidly rising since early June. BA.5 is responsible for nearly 3 out of every 4 new COVID-19 cases in the nation. Georgia is averaging a little more than 2,800 new cases a day, and these are largely driven by high transmission levels found among counties north of Macon. Some of the highest transmission rates are found in the state in the Northeast, along Brunswick, LaGrange areas, as well as Douglas, Henry, Newton, and Rockdale counties in the metro Atlanta area. COVID-19 new admissions or new hospitalizations in our state has continued to climb steadily since mid-May and represents 72% increase in the past 30 days and 18% increase in the past week. Hospital capacity remains very good. COVID patients occupy about 8% of the available bed space. And Georgia's death rate has remained relatively stable since mid-May at about 6 to 10 deaths per day. But lately, that rate has nearly doubled. For much of the pandemic, the only silver lining, for much of the pandemic, the only silver lining to coming down with a case of COVID-19 was that you likely wouldn't get it again for a while. However, more people appear to be contracting the virus multiple times in relatively quick succession. As BA.5 and BA.4 Omicron subvariants sweep through the U.S. and in our state, these strains seem to be able to escape our prior immunity. Omicron BA.5 subvariant has quickly become the most prominent circulating variant in the U.S. due to its ability to evade immunity, either from previous infection or vaccination. So just be aware of that. And though many experts believe BA.5 does not cause more severe disease than other variants, hospitalizations in many states are rising, and recent studies suggest that multiple infections can increase the risk of long-term COVID symptoms. The current Pfizer and Moderna vaccines still offer strong protection against COVID-19's worst outcomes, as long as you've already gotten the recommended boosters. Speaking of boosters, ages 50 and up can get a second booster of the Pfizer or Moderna vaccine at least 4 months after their first booster. And those 18 and up can get a booster of either Pfizer or Moderna vaccine at least 5 months after the second dose. Chief, that's all I have for the update this week. And y'all take care and have a good weekend.
All right, we're going to take a break from the update for just a second. We have Fire Chief is online. Chief, you want to share anything from your office? Chief Smith, we see that you're online now. You want to share anything from your office?
Hey, good morning, Steve.
All right, good morning.
Good morning, everyone. Just a note to let you know to stay cautious and stay alert. Please pay attention to what's going on. This COVID space is still ongoing. The goal is to keep you informed of what is going on for you to continue to protect yourselves and your families, and we will continue to have these meetings as the numbers continue to rise. Our magic number is 25, and so the goal is to stay informed and aware. We don't have all of the answers, but we will definitely work together to get through this. And I'll turn it back over to you, Steve.
All right, thank you, sir. Give me 1 second. I will share the screen again.
I don't know. You got something you need to say?
All right, so now we're going to move on to the monkeypox update. It's something that's been on the horizon. People talking about it, and we wanted to cover this. We have Dr. Bowers online today to discuss some of this, and we can go over that. Dr. Bowers, you want to go ahead and do some, and we'll go through what we have here on our screen as well.
Sure. Hey guys, good to see you. It's good to not be post shift for this for once. So the monkeypox situation is getting interesting. I personally had 3 patients in my last week of shifts. I haven't worked in about a week. I'm out of town, if you can't tell. But so that was just me personally. It's pretty distinctive, right? If you Google monkeypox, it typically looks just like that. And we've had a lot of people asking about risk, right? So is mostly close contact. So there is technically a respiratory component to it. So like in the hospital, we would put people on airborne and contact isolation. But what we're seeing with this particular outbreak is that most of the transmission is being driven by close physical contact, not only with the patient directly, but also with clothing and surfaces that they've also touched. So that was a little concerning. My third patient had been in the waiting room for 7.5 hours at Kennestone. I'm like, whatever they touch, can we just burn that down? But it becomes very hard to track, right? We know that there are some distinctive risk factors. Typically, we are seeing it with people who are engaging in sexual activity in their personal life. We are not seeing a significant amount of healthcare transmission. There are currently a higher prevalence. There's currently a higher prevalence of outbreaks within the community, specifically of men who have sex with men. However, that does not mean that it is limited to or exclusive of that particular population. And we are seeing patients outside of that population. We're seeing some distribution of lesions that's different than what we've seen in the past. So typically, if you read kind of Google some textbook on monkeypox or whatever, read up whatever's out there, they'll talk to you about diffusely disseminated rashes. You will see them on the hands and the feet, the face, and the trunk. We're also seeing clusters of lesions in genital areas, which is not inconsistent, right, with that close contact transmission. So make sure that you're using PPE, always, always, always gloves, always, always, always a mask for this and for other reasons. Like, I don't know, y'all, if I'm ever going to see a patient without a mask again. It's been pretty nice not being sick for the last 2.5 years, right? And then plus or minus gowns, particularly for you guys. I think the gowns will be more important. With me, my patients are on a bed. I'm not moving them around. I'm not transferring them from one place to another. So I can kind of like do this, right? Not actually get in super close physical proximity. But for someone that you might be having to help from a residence, move from a car, put onto a cot or a stretcher, and then potentially offload if you had to ride in with someone, then you would also want to use a yellow gown and then immediately discard that. So be extremely careful. Obviously, hand washing is super important. But I think, as always, with coronavirus too, sometimes our personal activities are the biggest risk. So we're seeing outbreaks at music festivals, we're seeing outbreaks stemming from nightclubs, and we're seeing outbreaks stemming from other kind of close, high-risk social gatherings. So, and very little so far healthcare transmission to date. Good, right? There is a vaccine. It's available in very, very limited numbers. And right now currently being distributed to the highest risk populations. There has been a request and a funding cut to increase manufacturing of the vaccine. So we may see more availability of that in the future. And I think that even you guys at this point, more so than me, should be first in line for those, because again, you have a higher risk for inevitable close contact with your patients. We are not currently seeing high rates of hospitalizations with the monkeypox patients. I think Kennestone has had either 8 or 9. So I feel like it's a dubious thing that I own a third of that. But we haven't hospitalized anybody yet. We have hospitalized a significantly higher number of coronavirus patients than we have even probably over the last 8 to 12 months, as has Grady. I believe that Grady has 70 inpatients right now, which is a much higher number than they had. And we know, just kind of throwing back to the numbers that we just looked at, those are all high and increasing. But remember that a lot of the cases that are out there right now are not being reported. People who test positive on their home antigen tests are not calling the state to report their infection. So that test positivity rate of 25% should concern you guys. Anything over 5% means that we're missing a significant amount of cases in the community, and we're at 25% positivity rate. So that is really the biggest threat to your health and safety right now. And I know that you guys are tired of listening to me bang that drum, but I'm just not going to do it. I'm just not going to stop yet. For instance, my mother actually tested positive this morning. So she was at an outdoor concert last weekend, which she thought was low risk for someone who tested positive on Tuesday. And she was actually supposed to be here on this trip with me. I'm up in Lake Placid for a race, and had waited her 5 days thinking it would be okay, and tested before she went to the airport and had to cancel the trip, which is a huge bummer. So just know that it's out there. It's making people sick. It's trying to kill Garner again. So that man has a talent for the coronavirus. But, and again, the biggest risk for you guys, I think, even more than hospitalization, would be kind of the damage that it could do to your long-term fitness, which not only affects, you know, if you're a runner or a biker or a hiker and like to do active things outdoors, but you guys have a physical job. So a long COVID diagnosis could significantly impact your ability to do your job and earn a living. And if anything should concern you, I think that that should. As always, I'm around for questions. I'm getting lots of texts and emails, and that's great. I'm always happy to answer. And then obviously, if you need something emergently, call no matter what time of day or night. And Dr. Waterman and I are always here to help out and answer questions. I know the monkeypox thing in particular is kind of new and it's unfamiliar, and it's not something we've ever had to worry about before. I'm not sure if you guys saw, there's also a confirmed case of polio in New York State now, and that patient is actually already experiencing paralysis. So, just what we needed was a few more what we thought eradicated diseases coming back for us. So please stay safe, please stay vigilant, please stay informed. If you have questions about where to go or where to get information, we're always here to help. We would much rather spend some time helping direct you to reliable sources than have you guys, falling down the vortex of the interwebs.
Dr. Bowers, thanks for mentioning the thing about the home test, and maybe those aren't being reported to the state, so we may have a higher positivity rate than what's showing out there. It's always something to bear in mind, and just maintaining social distances, making sure you wear a mask when you have to be too closely together, I think is a good thing. One of our greatest impacts so far with since we had an uptick in COVID was with people who were in training classes and very close knit with each other. It's not been so much the stations as it was the training center. And so we're going to have to monitor those. We're going to be careful in cleaning those spaces and trying to develop more space for our members as they go through training so that we have less possibility of transmission.
That's great.
Cases here, well, we'll get back here on monkeypox right quick. You can see the U.S. cases, a total of 2,323. This was as of yesterday, reported through the CDC. And then I put the any state that was or district that was over 100 cases, and they're listed right there: New York, California, Florida, Illinois, Georgia, and the District of Columbia, all with over 100 cases. And so it's just good for us to a good reminder to wear our proper PPE. The next slide is going to be a video from the CDC and going into adding to and just confirming what Dr. Bauer said. So we're going to listen to that right there.
Thank you for joining today's Director Debrief. Today, I'm joined by Dr. Dimitri Daskalakis, Director of CDC's Division of HIV/AIDS Prevention, to give an update on CDC's ongoing investigation and response to monkeypox cases.
CDC is tracking multiple outbreaks of monkeypox that have occurred in several countries that don't normally report monkeypox, including the United States. Several cases have been reported in the U.S. There have been no deaths reported in the current outbreak, either in the U.S. or other countries. Monkeypox is a rare disease caused by the monkeypox virus. People with monkeypox may first develop symptoms, including a flu-like illness with fever, headache, muscle aches, exhaustion, and enlarged lymph nodes, followed by a rash. In recent cases, patients have developed localized rashes on or near the genitals or anus without prior flu-like symptoms. Monkeypox can spread to anyone through close, personal, often skin-to-skin contact with someone who has monkeypox. This occurs through direct contact with monkeypox lesions, contact with contaminated objects, fabrics, and surfaces that have been used by someone with monkeypox, and contact with respiratory secretions and other body fluids from a person with monkeypox. Monkeypox can be spread during sex through skin-to-skin and other intimate contact. Anyone, regardless of gender or sexual orientation, can develop and spread monkeypox. Many of those affected in the current global outbreaks identify as gay or bisexual men. However, the current risk of exposure to monkeypox is not exclusive to gay and bisexual men in the United States. CDC is urging healthcare providers in the U.S. to be alert for patients who have rashes consistent with monkeypox, regardless of the patient's gender identity or sexual orientation. I strongly urge everyone to approach this outbreak without stigma and without discrimination. It will take a partnership between healthcare providers, affected people, and public health officials to ensure that people who need care can access it and to protect their loved ones. Our utmost priority is to help everyone make informed decisions to protect their health and the health of their community. And that starts with building awareness guided by science, not stigma.
Monkeypox is not a new or unknown disease. CDC has been preparing for monkeypox for decades, and we have the resources we need to respond right now. We will continue to provide the latest updates on CDC's monkeypox investigation to provide Americans, healthcare workers, and public health leaders the information they need to make the best informed decisions to protect their health and the health of their communities.
Okay. So here's the signs and symptoms that it discussed earlier. And again, this is from the CDC's website. We got fever, headache, chills, muscle aches, backaches, exhaustion, swollen lymph nodes, and a rash. And then you can see the images there of the rash. That's hands and other body parts under the lips, on the face. It can be anywhere of those, any one of those places. So just be aware, be cognizant of when you go on calls and be looking at your patient, making an assessment of them to determine that. However, we need to make sure that we are wearing the proper PPE. And as Dr. Bauer said, we want to make sure we're wearing those gloves. High risk procedures, you want to make sure you're going to have goggles on, the mask. It's just important. And then the gown up for contact. So let's make sure that we're doing that. We have plenty of those in stock, and we're prepared for these situations. It doesn't matter whether it's COVID or anything else there. So just make sure that you're wearing appropriate PPE when we go on these calls. Next, we're going to have a safety 360, and as Chief McLemore alluded to earlier, it's about vehicle stabilization. And so this happened in New York City this week. Right here, you can see there's a vehicle that's kind of up on its side. We'll play the video and then we'll talk further about it. So watch this video and then we'll discuss it.
It's the terrifying moment an SUV rolls over one of New York's bravest. It happened in busy Midtown Manhattan after a black BMW SUV crashed into a white sedan. A firefighter was trying to stabilize the BMW when a witness says the driver, who was trapped inside, accidentally hit the gas, causing the vehicle to come crashing down, crushing the firefighter's leg.
Oh my God!
Fellow firefighters and some good Samaritans rushed in to save him. So who was that brave firefighter pinned underneath? His name is Ryan Warnock, and what a hero he is. Just 1 week ago, he dove into the Hudson River to save those tourists after their boat capsized.
You just have a job to do, and you do it, and we train for this, and that's why we're here.
Miraculously, in this feat of heroism, Warnock only suffered a broken femur. This witness summed things up perfectly.
He's a true hero. That's a real New York hero right there.
So with that, that's something that we need to talk about. Share these when you're at the station. You see these things that pop up on YouTube. You see them in the news. You see them in other places. And it's a great time for us to have talking points to talk. What are we going to do in that situation? There's so many variables in the on that landscape today of what you are running calls on. You may be running an electric vehicle. You have vehicles that have push start. So you don't have an opportunity to just reach up and take the keys out and know the vehicle's at least off. So be aware of your situation, of what's going on around you. Know what's there. As you can see in that particular video, they were preparing a strut system to stabilize that vehicle, and they still had something that happened. And so being prepared, knowing what's going on around you, seeing what's there, shutting the power off to the car, that's just something that's really important for us to do as we arrive on the scene and start making our safety assessments and what we're going to do next, preparing for the incident. As you're getting ready to close out, Chief Harris, is there anything from field ops that you would like to share?
Thank you, Chief Hill, again for a great presentation. Situational awareness is key. That last video was a great example where situation can change quite drastically, quite fast. Engine 26 just recently suffered an accident on the expressway where they had some damage to the apparatus. Highway safety, when you're out there working on scene, please stay safe, head on a swivel at all times. Again, Stephen, great presentation with that. Go ahead.
All right. Thank you for joining in today. Do we have any questions over there, David? No, no questions. All right. If you do have questions later on, please let us know. We have AFRD-safety@atlantaga.gov. We'll go straight to the safety section. You can also send it to my personal email, call us. Our numbers are out there. We're constantly in contact with a lot of you. So have a good rest of your Friday, a good weekend. Stay safe, and we'll see you next week.